now I'd like to introduce Jazmine Feijo, who works for CHATS. She is a social worker here at CHATS, and I'd like to tell you just a little bit about CHATS. We are physically here in their fabulous venue here in Richmond Hill, Ontario. CHATS stands for Community and Home Assistance to Seniors, and their vision is very simple. They want older adults to be able to live safely and independently and well at home. So welcome, Jazmine, and I hope you enjoy her presentation.
Thank you, Mary, for the introduction. As stated, my name is Jazmine Feijo. I'm a caregiver education counselor with CHATS. I've been here for over a year now, and it's been a lovely experience working in the Caregiver Education Support Program. I'm going to give a little spiel about what CHATS does, and specifically our program here in relation to caregiving matters. So this quote really speaks to the event today and also just the experience of most of us who are here, whether we are in the role or we need it. It says, this is from former First Lady Rosalind Carter. There are only 4 kinds of people in the world: those who have been caregivers, who are currently caregivers, who will be caregivers, and those who are caregivers. Just to show the commonality of this, the normalcy of being in this role, and possibly needing to be in it for someone else. So as Mary stated, CHATS' mission. So CHATS is an innovative and value partner in the healthcare system. We deliver high-quality home and community services and experiences for older adults and caregivers. We have a range of programs and services. In addition to the caregiver support program that I'll talk more in depth, we have personal support services, transportation, Meals on Wheels, our Adult Day program, which we're at right now, and we have our social and wellness programs as well, and to increase social activity and engagement in the community to combat social isolation, as well as just to live independently and safely at home, in addition to our tenancy and risk and reduction programs, just to make everything safe and for you to live at home as long as possible. So CHATS, we are all across York Region, as well as South Simcoe and the northern part of York Region. Today we're here in Richmond Hill, one of our ADP locations, and we have our offices are in Vaughan, Aurora, and here in Richmond Hill, and Bradford. So specifically speaking to the Caregiver Support and Education Program, this program in specific, it provides quality information and referral, support groups, workshops, individual counseling, and web-based resources to caregivers of seniors in York Region and South Simcoe. Our services are to provide emotional support and education to caregivers to help prevent and combat caregiver burnout and address any caregiving concerns, alleviate stress, and provide helpful advice to increase their wellness and combat burnout. So this is specifically really important now that we're in COVID. I think we have the looming idea that our caregiving supports and services can be fatigued soon. We're at home a lot longer, we're taking care of people a lot more than we have in the past, and this can definitely lead to caregiver burnout and feelings of overwhelming. So we're going to talk more about that today. Caregiver support and education, our workshops include a range of information. For example, we have the system navigation and information. So this would be talking about, well, you're new to this role, you don't know where to begin, and maybe you need to know about the resources available, because that's part of the problem here. It's not only just knowing what's available, but also how to use it. We also have workshops specifically about CHATS programs and services. We like to offer wraparound, all-around care, and to show that it's a 360 degree where you can get services in one area and as well as in others. We have a workshop on power of attorney and capacity, wills and estate planning, government benefits, credits, and incentives, and some new workshops that we have as well to help with caregiver burnout is the Powerful Tools for Caregiver. And we also just partnered up with Canadian Mental Health Association to provide Living Life to the Full. This is a program specifically for caregivers, and it's also it talks about cognitive behavioral therapy to talk about your negative self-talk, have a more constructive, positive thinking pattern, especially in times like this when we're quick to think of the worst case scenario. It's good to be reminded of helpful tactics that you can use to get yourself out of those negative thought spaces. And then support for caregivers. We have stress management for caregivers, self-care for caregivers, and we've also recently added one specifically to what self-care looks like now that we're in a pandemic. It's different than it was before. Coping with change and loss and grief, setting boundaries as well. And one that we'll be adding very shortly is how to stay connected while being apart. Again, COVID is a big elephant in the room. We know that it has a huge impact on our ability to be with others, but that, like we were talking about before, it's not something that we have to physically be away with one another. We can still stay socially connected while being apart. And as mentioned, we do provide caregiver support groups on top of one-to-one supportive counseling. Our support groups we have now virtually, but when we did meet in person, we did meet in the office or in public spaces. We have our Aurora support group, which happens Wednesday evenings at 7 to 8 p.m. Bradford is Thursday mornings at 10 a.m. to 11. Georgina, Monday afternoons at 1. Richmond Hill, Tuesday afternoons at 2. Thornhill, Tuesday and Thursdays afternoons. This is tentatively, but it would be starting at 2. And Vaughan, Tuesday afternoons at 2:30. That is in partnership with Vaughan Community Health Center. And now that we're doing everything online, our locations have changed, but we're still talking about the same content, still getting together with one another, updating each other on how they're doing. Not only is it a great place to provide support to one another on caregiving related issues, but it's a great place to stay socially connected with people that you've been talking with for the last however many years that you've been joining CHATS support groups. So other ways that CHATS can help. So we provide respite care, which is specific to the Northern York region and South Simcoe. Subsidies are available for respite care as well. We do an income assessment and we it could be on a sliding scale. We also have virtual visiting, and friendly visiting was something that we started back before the new year. But now we're just doing the telephone reassurance calls, which takes place of the actual in-person visits. We also have transportation to local and distance appointments. Those are still taking place even in the pandemic. Adult day programs and the social and wellness programs. So if you ever need to get in contact with either I or my colleague Andrea, she works out of the Aurora and north part of our services. So if you are living in northern part of York Region or South Simcoe, she would be the person to contact. I've displayed her information on the screen here, as well as if you're in Vaughan, Richmond Hill, Markham, Thornhill, then I would be the person to contact for that. Again, we provide one-to-one supportive counseling as well as support groups and workshops or information and referral. If you ever need advice or if you have a question about if a service that you have in mind exists, we can help you figure that out.